Sjögren's syndrome destroys the brain and nervous system, what every patient must know. If you are waking up every day feeling exhausted, with your mind foggy, and your nerves constantly in pain, this is not just part of aging, but a silent disease attacking your body, slowly destroying your brain and nervous system. Sjögren's syndrome affects millions, often without warning, leading to devastating neurological damage that can go undiagnosed for years. But the truth is, it doesn't have to be this way. Understanding how this condition silently ravages your brain and nerves is the first step toward protecting yourself and taking control of your health. Stay with me to discover what every patient must know about Sjögren's and how to fight back. Sjögren's syndrome is an autoimmune condition that occurs when the body's immune system mistakenly attacks the glands responsible for producing moisture. These glands, which help produce tears and saliva, become damaged, leading to symptoms such as dry eyes, dry mouth, and difficulty swallowing. While these are the most common signs, Sjögren's affects more than just the body's moisture production system. The effects of this disease can be far-reaching, impacting other parts of the body in ways many people don't realize. The disease primarily affects women, particularly those over 40, though it can strike anyone at any age. For many, the symptoms may start out mild, almost as if a person is simply aging. However, the truth is that over 4 million Americans are living with this condition, and it often goes undiagnosed for years. This delay in diagnosis can be frustrating and lead to worsening symptoms, as individuals may not realize the cause of their discomfort. The symptoms often mimic other common conditions, which is why it can be so elusive to identify. While most people are familiar with Sjögren's syndrome for causing dry eyes and dry mouth, the damage extends beyond these surface-level symptoms. Over time, the condition can cause serious problems with the nervous system and brain. Studies have shown that individuals with Sjögren's are at an increased risk of cognitive issues, brain fog, and even conditions like depression and anxiety. The constant inflammation caused by the immune system's attack on the body can wreak havoc on nerve tissues, leading to discomfort, numbness, and tingling sensations that often go unnoticed. Imagine going through life, dealing with the daily struggles of dry eyes and mouth, and never suspecting the silent damage happening inside your body. The worst part? This damage could be slowly creeping into your nervous system, causing problems that may not appear until it's too late. But there's hope. Understanding the connection between Sjögren's and its effects on the nervous system can help you take the steps to protect your health. Let's explore how Sjögren's can impact the brain and nervous system in ways that are often overlooked. Many people with Sjögren's experience a range of neurological symptoms that can deeply affect their daily lives. The damage often goes unnoticed for years, leaving individuals to struggle with issues like brain fog, cognitive decline, and nerve pain without understanding the true cause. One of the most common and frustrating symptoms of Sjögren's is brain fog. Imagine feeling constantly tired, struggling to remember simple things, and having difficulty focusing on even the most straightforward tasks. This isn't just a normal part of life. It's the result of a chronic autoimmune attack on your body. Chronic fatigue, difficulty concentrating, and memory issues are all part of the cognitive dysfunction caused by this condition. Even with proper rest, these symptoms can persist, leaving you feeling mentally drained and disconnected from your surroundings. The brain, deprived of proper function due to immune attacks, struggles to keep up, making every day feel like an uphill battle. Worse yet, research has shown that people with Sjögren's syndrome are at a significantly higher risk of developing cognitive decline and even dementia. Some studies suggest that individuals with Sjögren's are 45% more likely to develop dementia compared to those without the condition. This connection is often overlooked, but the truth is that the neurological impact of Sjögren's is far more severe than many realize. The same chronic inflammation that affects other parts of the body also slowly destroys brain cells, leading to difficulties with memory, thinking, and even mood regulation. In addition to the cognitive struggles, nerve damage is another major consequence of Sjögren syndrome. The immune system's relentless attack on healthy tissues can lead to neuropathy. In this condition, the nerves become damaged, causing pain, numbness, tingling, or weakness in the limbs. This nerve damage can make it difficult to walk, grip objects, or even perform basic tasks without discomfort. Studies have shown that nerve damage in Sjögren's patients is underrecognized, which means many people go undiagnosed until the damage has already become significant. By the time the nerve issues are noticed, the damage may be irreversible, making it all the more important to recognize the symptoms early on. The role of inflammation in Sjögren's cannot be overstated. Chronic inflammation is a key factor that drives both brain and nerve damage. When the immune system attacks healthy cells, it triggers inflammation that affects not only the target areas, like the eyes and mouth, but also the brain and nervous system. This constant state of inflammation weakens the nervous system and impairs its ability to function properly. Inflammation makes nerves more susceptible to damage and can even disrupt the brain's ability to transmit signals efficiently, which is why cognitive and sensory issues are so prevalent in people with Sjögren's. In addition to the direct effects on the brain and nervous system, Sjögren's syndrome can increase the risk of developing other neurological conditions. One of the most concerning risks is the potential development of multiple sclerosis-like symptoms. Research suggests that the inflammation caused by Sjögren's can mimic the effects of multiple sclerosis, leading to similar symptoms such as muscle weakness, numbness, and impaired coordination. The link between Sjögren's and these MS-like symptoms highlights the seriousness of the condition and the need for early intervention to prevent further neurological damage. Furthermore, up to 20% of individuals with Sjögren's experience peripheral neuropathy, which is a painful condition that affects the nerves outside of the brain and spinal cord. This type of nerve damage can lead to burning pain, tingling sensations, and weakness, particularly in the hands and feet. The pain can be debilitating, and it can interfere with a person's ability to perform daily activities, such as walking or typing. For many patients, the nerve damage becomes a significant burden, affecting not only their physical well-being, but also their emotional health as they deal with chronic pain and the frustration of living with an invisible condition. Living with Sjögren's is not just about managing dry eyes or a dry mouth. It's about understanding the full scope of the damage this condition can do to the brain and nervous system. The neurological symptoms, including brain fog, cognitive decline, and nerve damage, can have a severe impact on the quality of life, leaving patients feeling isolated and helpless. Recognizing these symptoms early and seeking proper medical care is crucial to slowing the progression of the disease and preventing long-term damage. But what can be done to manage these neurological effects and protect the brain and nerves from further harm? In the next section, we will explore the steps that can be taken to prevent and manage brain and nerve damage caused by Sjögren's syndrome. Before we move on, I'd love to know where you're watching from. If you're working to naturally alleviate nervous system issues, be sure to subscribe to Knowhow and turn on the notification bell. And if this content helps you, type 1 in the comments or 0 if it doesn't. I want to keep improving for you. Sjögren's syndrome often goes beyond the familiar symptoms of dry eyes and mouth. Its silent impact on the nervous system is something that is frequently overlooked, but can be far more debilitating. Many individuals suffering from this condition are unaware of how it subtly damages the brain and nerves, leading to a host of symptoms that affect daily life in ways that aren't always immediately connected to the condition. The longer it remains undiagnosed or untreated, the more severe these symptoms can become, making it essential to understand what to watch for. One of the most common yet misunderstood symptoms of Sjögren's is fatigue. Imagine waking up every day feeling completely drained, even after a full night's sleep. This exhaustion doesn't go away, no matter how much rest a person gets. It's not just being tired, it's a constant, all-consuming weariness that leaves individuals unable to keep up with their regular activities. This fatigue can severely disrupt daily life, making it challenging to work, socialize, or attend to personal responsibilities. Unfortunately, many people with Sjögren's are told that fatigue is just part of life or a side effect of other health issues, so it often goes untreated for years. Yet this tiredness is one of the first signs that something more profound is amiss. Along with fatigue, cognitive issues are another red flag that can point to the silent damage Sjögren's is inflicting on the nervous system. Difficulty concentrating, processing information, and retaining memory can make even the simplest tasks feel overwhelming. Everyday activities like reading, following conversations, or remembering appointments can become insurmountable challenges. This cognitive fog, often referred to as brain fog, is frustrating because it affects one's ability to function effectively, leaving individuals feeling disconnected and less productive. The constant struggle to focus or recall important details can erode confidence and make it difficult to engage in both personal and professional aspects of life. As if cognitive issues weren't enough, nerve pain is a common and distressing symptom for those with Sjögren's. Many people experience burning, stabbing, or tingling sensations, particularly in the arms and legs. These sensations can range from uncomfortable to downright painful, making it difficult to walk, hold objects, or even relax without discomfort. For many, nerve pain becomes a daily part of life, but it's often dismissed as just another symptom of an autoimmune condition. The pain can vary in intensity, and in some cases it worsens over time, leading to more severe nerve damage. Unfortunately, nerve pain is often treated as an isolated issue when, in reality, it's a critical sign that the body's nervous system is under attack. Scientific studies have shed light on the extent of neurological involvement in Sjögren's patients. Research shows that nearly 40% of those diagnosed with the condition experience significant neurological symptoms. Despite this, these issues are often underrecognized or attributed to other causes. For many individuals, it's only when the nerve damage has become significant that they realize the true impact of the condition. This is alarming because early detection and intervention are key to preventing further damage and improving quality of life. Without proper treatment, the damage to the nervous system can continue to worsen, leading to permanent disabilities that can affect mobility, cognitive function, and even mental health. The progression of nerve damage in Sjögren's can be insidious. It often starts with subtle symptoms that may seem trivial at first. However, over time, the effects on the nervous system can become more pronounced, leading to debilitating conditions like chronic pain, memory loss, and even difficulty with basic motor skills. Once nerve damage becomes advanced, it can lead to permanent disabilities that are not easily reversed. The loss of nerve function can make daily tasks nearly impossible, and the constant discomfort can leave individuals feeling trapped in their own bodies. By the time these symptoms are recognized, the damage may be irreversible, which is why early intervention is crucial to slowing the disease's progression. Living with Sjögren's syndrome can be isolating. Symptoms such as fatigue, cognitive issues, and nerve pain can drastically reduce a person's quality of life. Work becomes a struggle, and social interactions can feel draining. Individuals with Sjögren's may begin to withdraw from social activities, not because they want to, but because their body feels like it's failing them. The constant fatigue and pain can make them feel like they're letting people down, further deepening their sense of isolation. Their condition is invisible to others, making it even harder for friends, family, and colleagues to understand the true impact it has on their lives. This emotional toll can be just as severe as the physical symptoms, contributing to feelings of frustration, depression, and hopelessness. Sjögren's syndrome may be a silent threat to the nervous system, but that doesn't mean it has to go unnoticed or untreated. Understanding the symptoms and recognizing how they disrupt daily life is the first step toward taking control. It's not just about managing dry eyes or mouth, it's about addressing the deep, silent damage happening inside the body. But what can be done to prevent this silent destruction? Let's explore how to manage and protect the brain and nervous system from further harm caused by Sjögren syndrome. The connection between dryness and nervous system damage is not always immediately obvious. Many individuals with Sjögren syndrome are familiar with the discomfort caused by dry eyes and mouth, but these symptoms go beyond just being inconvenient. Chronic dryness can have a direct impact on the nervous system, triggering a cascade of problems that affect the brain and nerves in ways people might not fully understand. Dry eyes, for instance, are more than just a feeling of irritation. Over time, a lack of moisture in the eyes can lead to serious inflammation. This inflammation doesn't just affect the tear ducts. It can spread to other parts of the nervous system. The inflammation in the tear ducts can increase the risk of central nervous system involvement, which means the brain and spinal cord can also be affected. As the immune system continues to attack healthy tissues, it can lead to long-term damage that affects cognitive function, memory, and even mood. This link between the eyes and the nervous system shows just how much Sjögren's can influence the body's neural health. The same goes for dry mouth. Many people with Sjögren syndrome find it difficult to speak, swallow, or eat due to the constant lack of moisture in their mouths. This is not just a result of dehydration, but a lack of saliva, which is essential for maintaining proper nerve function. When the salivary glands are under attack, it disrupts the delicate balance of moisture that is needed to keep the mouth's nerves working properly. This dysfunction can make swallowing difficult and painful, as the nerves responsible for these actions are not receiving the necessary support. Without proper saliva production, the nervous system in the mouth becomes compromised, leading to discomfort and, in some cases, long-term nerve damage. One of the most concerning aspects of dryness is the link to dehydration. When the body lacks moisture, it struggles to regulate its temperature and perform basic functions. The nervous system, which relies heavily on hydration to send and receive signals, becomes overburdened by dehydration. This additional strain places further stress on the nerves, making them more susceptible to damage. Dehydration affects everything from nerve signaling to blood flow, further complicating the effects of Sjögren syndrome on the body's neural health. Increased inflammation is another critical factor in how dryness can damage the nervous system. When the body is chronically dry, it triggers an inflammatory response that can exacerbate nerve damage. Inflammation is the body's natural response to injury, but when it becomes chronic, it does more harm than good. Inflammation caused by dryness can directly affect nerve function, leading to pain, numbness, and tingling sensations. As the inflammation spreads, it creates a vicious cycle, exacerbating the symptoms of Sjögren's and hindering the body's ability to repair itself. Scientific studies have begun to uncover the close link between dryness and neurological damage. Research has shown that inflammation in the tear ducts, a common symptom of Sjögren's, can increase the risk of central nervous system involvement. This means that the damage caused by chronic dryness is not limited to the eyes but can extend to the brain and spinal cord. Additionally, studies on the link between saliva deficiency and nerve function show how a lack of moisture can disrupt normal nerve activity in the mouth and throat. This dysfunction leads to painful symptoms, making it clear that the nervous system is deeply affected by the body's inability to produce moisture. The effects of dryness on the nervous system are more than just uncomfortable. They serve as a poignant reminder of how profoundly Sjögren syndrome can impact the body. The chronic inflammation and dehydration that come with the condition create a cycle of damage that can take a serious toll on the brain and nerves. Recognizing this connection is crucial for individuals living with Sjögren's, as it can help guide them toward more effective management and treatment options. So how can these symptoms be managed and prevented from causing further damage? Let's explore. Managing and preventing the progression of brain and nerve damage from Sjögren syndrome requires a multifaceted approach. While there is no cure for the condition, a combination of medical management, lifestyle changes, and regular monitoring can significantly improve quality of life and help protect the nervous system from further harm. If you are living with Sjögren's, it is crucial to take proactive steps to manage both the symptoms and the underlying inflammation that contributes to neurological damage. One of the most fundamental strategies for managing Sjögren's syndrome and alleviating some of its most uncomfortable symptoms is staying hydrated. Chronic dryness, particularly in the eyes and mouth, can be alleviated with consistent hydration. Drinking plenty of water and using moisturizing eye drops and mouth rinses can help reduce discomfort. These simple actions may not completely eliminate symptoms, but they can help minimize the impact of dryness and provide some relief throughout the day. Keeping your body hydrated also supports overall bodily functions, including those of the nervous system, by ensuring that it has the moisture needed for proper nerve signaling and function. In addition to hydration, medications play a significant role in managing the inflammatory aspect of Sjögren syndrome. Drugs like hydroxychloroquine, commonly known as Plaquenil, are often prescribed to reduce inflammation and suppress the immune system's attack on healthy tissues. This medication, when used in conjunction with corticosteroids, can be effective in reducing the autoimmune response that causes dryness and other symptoms. By targeting the root cause of inflammation, these medications can help prevent further damage to the brain and nervous system. However, it's essential to consult a doctor to determine the most suitable course of treatment based on individual health conditions and needs. If you're finding this helpful so far, please take a second to like this video. It may seem small, but it tells YouTube that this message matters and helps Knowhow reach more people who truly need it. If you believe others deserve this knowledge too, tap that thumbs up now. For those dealing with nerve pain, neurological treatments can offer significant relief. Certain medications, such as gabapentin, are often prescribed to reduce nerve pain and improve the quality of life for those with nerve damage. These medications work by calming the overactive nerves and helping to ease the discomfort associated with neuropathy. It's essential to note that nerve medications may not completely reverse nerve damage, but they can help manage symptoms and improve quality of life. Beyond medical treatments, diet and lifestyle choices play a crucial role in managing Sjögren syndrome and protecting the nervous system. An anti-inflammatory diet rich in omega-3 fatty acids, antioxidants, and vitamins D and E can help reduce inflammation throughout the body. Omega-3 fatty acids, found in foods such as salmon, flax seeds, and walnuts, are recognized for their ability to reduce inflammation and support brain health. These healthy fats are especially beneficial for the nervous system, helping to reduce the effects of chronic inflammation that contributes to nerve damage. Regular physical activity is another important component in maintaining nerve and brain health. Exercise has been shown to improve blood flow, reduce inflammation, and even enhance cognitive function. While it may seem difficult to maintain a regular exercise routine due to fatigue or discomfort, even light activities like walking, swimming, or yoga can have profound benefits for individuals with Sjögren syndrome. Exercise not only helps manage symptoms, but also promotes overall well-being and reduces the stress that can exacerbate autoimmune conditions. Speaking of stress, managing it is vital in preventing flare-ups of Sjögren's and maintaining both mental and physical health. Stress can trigger inflammation and worsen symptoms, so it's essential to find ways to relax and recharge. Practices such as yoga, meditation, and mindfulness can be incredibly beneficial in managing stress. These relaxation techniques help lower cortisol levels and mitigate the negative effects that stress can have on the immune and nervous systems. Even just a few minutes of deep breathing or meditation each day can make a significant difference in how the body handles stress. Supplements can also play a role in supporting brain and nerve health for those with Sjögren's syndrome. Omega-3 fatty acids, as mentioned earlier, are essential for reducing inflammation and promoting cognitive function. Additionally, maintaining optimal levels of vitamin B12 is crucial, as a deficiency in this vitamin can exacerbate nerve damage. Vitamin B12 supports nerve health and cognitive function, so it's important to ensure that levels are adequate. Turmeric, specifically the active compound curcumin, is another supplement known for its anti-inflammatory properties. Curcumin has been shown to help protect against both brain and nerve damage by reducing inflammation and oxidative stress, two key factors that contribute to the damage seen in Sjögren's patients. Lastly, regular monitoring and checkups are critical in preventing further damage and ensuring early intervention. Neurological assessments should be part of routine care for individuals with Sjögren's syndrome, especially since nerve damage can progress over time. Regular brain function tests, including cognitive assessments, can help detect early signs of cognitive decline, such as memory loss or difficulty concentrating. Catching these signs early allows for timely intervention and treatment, which can slow the progression of nerve and brain damage. While there is no cure for Sjögren's, taking control of these factors can help slow the progression of damage and protect overall health. Managing the condition is not just about alleviating symptoms. It's about protecting the body from further harm and taking proactive steps to ensure a healthier future. The next step is recognizing the signs early and understanding how to take charge of your health before the damage becomes irreversible. Living with Sjögren's syndrome can be overwhelming, but many individuals have found ways to improve their lives through proper management, support, and understanding of the condition. Real-life stories of patients who have faced these challenges head-on provide hope and inspiration for others going through similar struggles. Take, for instance, Case Study 1. A patient who struggled with brain fog and fatigue for years finally received the correct diagnosis of Sjögren's syndrome. Once they began a treatment plan that included hydration, medications, and anti-inflammatory dietary changes, their brain health significantly improved. With the help of a neurologist and a team of specialists, they successfully stabilized their cognitive function and reduced the impact of brain fog. This patient shared how their ability to concentrate and recall important information returned after months of consistent care. While it wasn't an overnight transformation, they noticed significant improvements in their mental clarity, which greatly enhanced their daily life. Their success story highlights the importance of a tailored treatment plan, the right medications, and lifestyle modifications in managing the cognitive effects of Sjögren's syndrome. Another inspiring story comes from Case Study 2, where a patient struggled with chronic nerve pain and numbness in their hands and feet, making it difficult to perform basic tasks. They had been living with these symptoms for years without knowing the root cause. After receiving their diagnosis, they worked with a healthcare provider to create a treatment plan that included prescribed medications, such as gabapentin, to alleviate nerve pain. Additionally, they made adjustments to their lifestyle, including regular physical activity, stress management techniques like yoga, and a diet rich in anti-inflammatory foods. Over time, these changes helped reduce nerve pain, improve mobility, and enable the patient to return to activities they had once had to abandon. Their journey shows the power of combining medication with healthy lifestyle changes to combat the debilitating effects of nerve damage. The journey of living with Sjögren's syndrome can feel isolating, but finding support can make a world of difference. Joining online or local support groups is a powerful way to connect with others who understand what you're going through. These groups provide a safe space for sharing experiences, exchanging coping strategies, and offering emotional support. Knowing that others face similar challenges can be comforting and help alleviate feelings of loneliness. Support groups can also provide valuable information about treatment options, research studies, and emerging therapies, helping you stay informed about your condition and treatment. Education and awareness are key to advocating for yourself and receiving the best possible care. The more you understand about Sjögren syndrome, the better you can communicate with your healthcare team, ask the right questions, and ensure your concerns are heard. Learning about the latest research, treatments, and lifestyle modifications can empower you to take charge of your health. It's essential to approach your doctor's appointments as a partnership, where both you and your healthcare provider work together to create a personalized treatment plan tailored to your unique needs. Being an active participant in your healthcare is essential for achieving the best outcomes. Mental health is another crucial aspect of living with Sjögren syndrome that often goes unnoticed. Having an invisible illness can take a significant emotional toll. The fatigue, chronic pain, and cognitive challenges can lead to feelings of frustration, sadness, or even depression. Therapy and counseling can provide support, help you manage stress, and improve emotional well-being. Many people find that having a therapist or counselor to talk to helps them process their feelings and develop coping mechanisms for dealing with the emotional weight of living with a chronic illness. Taking care of mental health is just as important as managing physical symptoms. If this video was helpful, please don't leave without subscribing to Knowhow. And if you feel like I truly understood your struggle and offered a solution that matters, type the word relief in the comments. I'd love to know if this was helpful to you.